time to study. Starting off with professional skills. I likely don't need to know all that. Okay, well, OSU Vet School apparently has a bunch of funds going to new upgrades. It's good to know. In years past, they were limited because the vet school's funding was sporadic, I guess, and just some from here, some from there. The curriculum was different, facilities were different, etc. Anyway, so year 1, year 2, year 3, everything's pretty much the same. There's going to be clinical skills, communication, and whatever it's called, CCC. So semester 1 all the way through semester 6 in year 3 is going to be CCC 1, 2, 3, 4, 5, 6. And then we have professional skills 1, 2, 3, 4, 5. That's it looks like. Because in year 3 there's going to be junior surgery. And then anatomy, comparative anatomy, diagnostic imaging, I guess. And then there's a bunch of other stuff. A bunch of stuff. So this semester I'm doing CCC 1, Professional Skills 1, Anatomy, just gross and developmental anatomy, Phys and Histo 1, which is physiology and histology, immunology, nutrition, and then epidemiology, or evidence-based medicine. And I'll probably just tell y'all what the other stuff is once I know, or once I'm taking it. C's get degrees. So, yeah, if it's above 70%, then it's a passing grade in vet school. Okay. Hi. Okay, let's see here. We're done with that. On to Phys and Histo. I don't think I named this live, but I'm studying for vet school. I'm basically just recording myself studying to help me study so I can go back and watch these, but maybe it'll help some other people too. So that's the reason I'm doing it. Okay. Connective tissue. So there is irregular and regular dense connective tissue. Irregular connective tissue, collagen fibers, close to med school, but it's actually vet school, like veterinarian for animals. I'm going to be an animal doctor. So irregular, this is where the collagen fibers are irregular, not surprising. This is found mostly in the dermis. I wish I could show pictures, but it's illegal, so I can't show these slides. And I don't know if I can show my notes either, because a lot of what I took notes on, I just kind of copied and pasted. Anyway, like I took screenshots. Anyway, regular dense connective tissue. The collagen fibers are regularly spaced. Again, that makes sense because it's regular. But this is where fibroblasts are wedged between collagen fibers. And I think fibroblasts make collagen. No, they make stroma, sorry. That's a review from the other day. Regular dense connective tissue is not as vascular, so it doesn't heal as well. This is found in like the cornea of the eye, corneal epithelium. I'm not a doctor yet. My channel name is kind of just, I'm going to be a doctor, but it's going to be a veterinarian, so an animal doctor. Okay, another example of regular dense connective tissue is tendons, ligaments, and aponeuroses. I don't know if that's how you say that. Aponeuroses. They're basically just thin, flat versions of tendons. But ligaments attach bone to bone. Tendons attach muscles to bone. Okay, now moving on in connective tissue, we've got cartilage. There's 4 cell types in cartilage. It's shared, well, it's the same in bone, but they're just named different. Cartilage, the first cell, the youngest cell. Can a torn shoulder cause panic disorder? I don't know. I'm not a doctor yet. And even if, what's the signalment? Is it for an animal or a human? I don't know. So anyway, cartilage have progenitor cells. So this is like the source of where all these cells come from. They're stem cells. Stem cells can basically grow into any kind of cell. Next, we have chondroblasts. These are cells that produce cartilage. These are like worker cells, if you want to call it that. Then we've got chondrocytes, which are basically the same as chondroblasts, except they're mature and they just live within the cartilage they made. They don't do much. Any tips for debilitating anxiety? Seek Jesus. Chondroclasts. They break down cartilage. These are resident macrophages. So macrophages are an immunological cell that breaks down stuff. Yeah. Okay, next on to bone. Again, you got the same names, but it's different because these have osteo in front of them. So these are osteoprogenitor cells. Again, stem cell. Osteoblasts. These are cells that produce bone. Osteocytes, where chondro means cartilage and osteo means bone. Osteocytes, they live in lacunae, which they live in the bone they made, and then they just kind of live there, they just stay there. Osteoclasts break bone down. Okay, so cartilage is cells plus extracellular material. Chondroblasts actively secrete chondroid matrix. Chondrocytes are less active but still active. They also live in lacunae, so the cytes live in lacunae. And then chondroclasts reabsorb or dissolve cartilage. Now, this extracellular matrix is made of ground substance and fibers. And these fibers are collagen and elastin. Ground substance is like a goo. It's like made of water and I got it up here somewhere. Water and glycosaminoglycans. Glycosaminoglycans, which are composed of hyaluronic acid and chondroitin sulfates. And then there's more, of course. But you've heard of hyaluronic acid. I don't even know if I'm saying that right, but you've probably heard of that. It's good for your skin. And then chondroitin is good for your joints. So it makes sense because that's what ground substance is made of, and that's what cartilage is made of. There's a reason it's good for your skin. It's because your skin's literally made of collagen. I mean, it's got a lot of collagen in it. That's one of the most what's the word? That's one of the most present components of protein in our skin, collagen. Okay, there are 3 types of cartilage. Hyaline cartilage. There's not as many cells embedded in the blue matrix, and it's usually surrounded by perichondrium, which are bands of fibrous connective tissue. It's found in the tracheal and bronchial rings, so trachea. It's found in the larynx, nose, and ends of the ribs, and then it's found in articular surfaces of bones. It's also found in the growth plates of bones. Next we have fibrocartilage, which are orderly bundles of collagen. These are basically just chondrocytes arranged in lines. And these are found in intervertebral discs, menisci, symphyses, and they're usually found at ligament or tendon attachments to the bone. Okay? And then the third type is elastic cartilage. It's similar to hyaline cartilage, except it's got more elastin than collagen. This is found in structures that need to be pliable, like the ear, external ear, the ear canal, so the internal ear, and the epiglottis, which is like, I think it's the back roof of the mouth. Yeah. Okay, so again, hyaline, fibrocartilage, and elastic cartilage. Hyaline is joints, trachea, fibrocartilage, some in joints and menisci, and then elastic, epiglottis, pinna of ear, and ear canal. Okay, bone characteristics. Bone is always changing, and it's actually highly dynamic. Now, when we think of bones, we think of a hard, static tissue, but it's not. It's a very specialized connective tissue. It's highly vascular. It's got a lot of blood. It's got a lot of blood flow. I mean, if you got a fracture, you could potentially bleed out depending on where that fracture is. That's how vascularized bone is. Now, bone functions as internal support. It acts as a site of muscle attachment. It protects your organs, and it stores calcium. Back to these bone cells, we've got osteoprogenitor cells. These contain periosteum and endosteum. The peri meaning the perimeter, and endo meaning inside. These come from mesenchymal stem cells, and it's very difficult to see these osteoprogenitor cells histologically, like on a microscope slide. Then there's osteoblasts. These form osteoid which is unmineralized extracellular matrix. And these are found on the surfaces of immature bone that's still growing. Next, we have osteocytes. These live in the lacunae of mature bone. They're similar to cartilage. They just hang out. They're not mitotically active. They're not dividing anymore. They're not making new bone. They're just sitting there in the bone they've created. Then we've got osteoclasts. These are large multinucleated cells, and they don't come from osteoprogenitor cells. They come from the same cell line as macrophages, like I said earlier. Okay, and then we have so there was an example given of osteosarcoma. It's basically just osteoblasts that proliferate uncontrollably. Osteoclasts secrete acids and enzymes, and these lead to bone resorption. So like the bone gets reabsorbed. The scalloped edges that they create where they dissolve the bone, those are called Howship's lacunae. Okay, back to components of bone. We've got extracellular matrix. Extracellular matrix is... Well, hold on. Never mind. I think this is wrong. So the components of bone, I'll just say 70% inorganic matter. So that's mineral content. That's calcium and phosphate salts. Hydroxyapatite, you might have heard of that in some toothpastes. Okay, and then we have 30% organic matter. 90% of that 30% is collagen, and then 10% of that 30% is ground substance, which is again water, glycosaminoglycans, and etc. Okay, then we have two mechanical properties of bone. There's a compressive property, which comes from the mineral hydroxyapatite, and it's twice that of the tensile property. Very powerful. I mean, think about it. Bones have to hold up the weight of whatever they're a bone in at all times, pretty much. But they also have a tensile property. Now, tensile, I think, is when you're trying to pull it apart. Compressive is that, obviously, but then tensile, I think, is pulling it apart. Or maybe it's bending? I'm not sure. I'm going to look that up. Yes, capable of being drawn out or stretched. So bones have half the tensile strength of their compressive strength. Now there was something I was going to say that I wrote down. This was from an earlier study session that I did. I think it was, well, I'll have to think here for a second, because I erased it, I think. Did I? Do epithelial cells have blood supply? No. They get blood by diffusion from, what's it called? Basal cells. Yeah. Hello. How to be a doctor? Well, step one, get into school to be a doctor, I guess. And then step two, get through school to be a doctor. Then step three, be a doctor. I'm in vet school right now. I'm not a human doctor, but I know a lot about human medicine just because things are very, well, I don't know a lot yet. I'm only in my first semester, but I've got 7 more to go. But a lot of things are shared between human and animal medicine. Okay, that's cool. That is awesome. Anyway, I gotta get back to this study material here. So, the tensile property of bone comes from collagen. And then we have 2 types of bone. We have compact or cortical bone. This is the thick outer wall of the diaphysis. It provides mechanical strength. And there's lots of dense lamellae, which means layers. And so compact bone equals cortical bone equals lamellar bone. Next, we have spongy or cancellous bone. Cancellous, I think, is that how you say it? Hey Gabe, how you doing? Alright, spongy bone. This fills the epiphysis and medullary cavity, and it's made up of trabeculi, which are thin bony projections. Then back to compact bone. This is made of osteocytes mostly. This is old bone, or not old, but it's already been made. So these osteocytes are in lacunae, and then canaliculi, I don't know how you say that, I think that's how you say it, but those contain cell processes. And then another component of compact bone is the extracellular matrix, which there's the mineralized matrix, which is deposited in layers. Those are the lamellae, and that's inorganic because it's mineral. And then there's Haversian canals, which these contain the blood vessels. They run longitudinally in the bone, so like long ways through the bone. And then they're concentrically surrounded by lamellae. Then there's the osteon, which is a Haversian canal plus surrounding lamellae. Wish I could show these pictures. They make it a lot easier to understand, but I can't. Okay, back to spongy bone. The spongy bone doesn't have Haversian canals. Instead, they have trabeculi of bony spicules, which these are very fragile. That's why spongy bone is on the inside. And it's lined by a thin layer of endosteum. They have some lamellae, but not very many. Hi, Gabe. And then periosteum is the outer covering of bone. Because, like, you've probably heard of the word perimeter. Perimeter. Peri means around. Okay, there's 2 layers of this periosteum. There's the outer layer, which is dense connective tissue. It has few cells. There's the inner layer, which is very cellular. This is where osteoprogenitor cells, which are the, I don't know about what they, I remember on the slide they said this, but I don't think that's right. That's just where the osteoprogenitor cells and the osteoblasts live. Then there's the endosteum, which is a very thin layer of flat cells, some osteoblasts. This lines all the cavities of bone, because endo means within. These contain haversian canals and spongy/cancellous bony trabeculae. Okay, so the osteoid is deposited. It's secreted by osteoblasts and it's unmineralized. Then it's mineralized by calcium phosphate deposits, and the collagen fibers are randomly organized. Then it's remodeled, because that's how woven bone becomes organized lamellar bone. Woven bone. It's pretty cool. That's why bone is dynamic and constantly changing. Wow. Yeah. Endochondral ossification. These are in weight-bearing bones like the vertebral column, the pelvis, the limb bones. It uses a hyaline cartilage template. In summary, intramembranous ossification is the non-weight-bearing bones and flat bones of the skull, and etc. It's an increase in bone thickness via trabeculae, and it does not use a pre-existing cartilage model. The endochondral ossification is the weight-bearing bones, like the vertebral column, the pelvis, the limb bones. It's an increase in bone length, and it does use a pre-existing hyaline cartilage model. Okay, and that's it for phys and histo. Now on to nutrition again. Okay. Energy. Energy powers all biological processes. Energy producing nutrients are used to satisfy energy needs first, and they are measured in kilocalories. Animals have the ability to properly regulate energy or food intake, but sometimes it's a little strange. Nutrition, very controversial. This is where like pet obesity comes in. My opinion is that it's because they're fed the wrong things. But I mean, we'll just keep reading here. The kcals of food and pets' maintenance energy requirements determine how much you feed your pet. Metabolizable energy is the most relevant for pet nutrition because it equals GE. I don't know what GE means. I forgot. Something energy minus fecal energy loss minus urinary energy loss. It's the amount of energy that's used, basically. So ME values are influenced by what the food is made up of and what is eating the food. Like, you can't really feed a cow a steak. First of all, that's cannibalism for the cow. Second of all, their digestive system is not optimal for digesting that. Okay, determining maintenance energy. There's direct measurement, which is through feeding trials, and these get the most accurate maintenance energy values. And then there's calculation methods. These are more common because they are less expensive and they take less time. I think that's where people like burn food to measure the caloric content. It's just not that accurate because not all food in our body, we don't have a furnace burning the food. It's different. It's metabolism versus combustion. Okay, then there's modified Atwater factors, which is basically a bunch of jargon. So in 1 gram of protein, there's 3.5 kcals. In 1 gram of carbohydrate, there's 3.5 kcals. In 1 gram of fat, there's 8.5. Now these values range, or they vary wildly. Some people say proteins and carbs are 4 and 4, and fat is 9. Some people say proteins and carbs are, I think it was 4 or no, it was like, I don't know, it was some weird value. And then the fat is 9.45, I think. Protein and carb was 4.25. Yeah, something like that. Then there's an equation. You can estimate maintenance or metabolizable energy because some foods aren't very high quality and some foods have high fiber, which are not very digestible, at least not for monogastric animals. And then there's a bunch of jargon here, ways to calculate it. I hope I don't need to know this. There's also the guaranteed analysis on product labels. They're coming out with new ones, apparently, for pet food labels, which are going to be similar to human food labels. That'll be very helpful for the public, I think. Okay. Yeah, a bunch of formulas here. An increased energy density equals a decreased volume of food eaten. So if there's more energy in the food, you're going to eat less. Which, it's no wonder, if people are eating salads all the time, it's no wonder people are eating so much and they're so hungry. It's because there's no energy in the salad, really. The old thought was that if you eat a bunch of fiber, it'll make you skinny because, it just inhibits nutrient absorption. But if you eat a bunch of food that's good for you, like meat, beef steak or chicken or eggs, why do you want to inhibit that nutrition with fiber? There's no reason. And you're going to stop eating when you're full, when you're comfortably stuffed. You're just going to feel not hungry anymore. You're going to be like, oh, this isn't starting to, or this is starting to not taste good. And that's your body telling you that you're full. Anyway. Okay, and then there's energy requirements. There's a resting energy requirement, which is if an animal were not doing anything, they were just resting. And then there's a maintenance energy requirement. I think we'll talk about that later. Okay, then there's body condition score. There's a 5-point scale, a 9-point scale. The 9-point scale is more accurate because it's more varied. You know, there's more, it's more preferred. There's more graduations. It's only a starting point, though. It's not always accurate because it's subjective. It overestimates the ideal body weight for extremely overweight patients, too. Ideal body weight equals current body weight and then divided by the division factor. So ideal is 5 out of 9. Each 1-point change is a difference in 10% of body weight. So you got to remember that too, because if you've got an animal that's obese and you are giving medication based on its obese weight versus its ideal weight, you could overdose that animal and it could die or get severely injured as a result. You want to use ideal body weight to estimate energy requirements and also dosages. Okay. So animals that are more active need more energy. Animals that aren't need less, obviously. Bigger animals don't have higher metabolic rates. Actually, smaller animals have higher metabolic rates per kilogram of body weight. I mean, an elephant obviously eats a whole lot more than a human, but per kilogram of body weight, hi Martin, a smaller animal needs more. So like a mouse, if you were to multiply the mouse's metabolic rate by the weight of an elephant, the mouse would need a ton more than the elephant. Like if you had a mouse that weighed as much as an elephant, that mouse would need way more energy than the elephant, if that makes sense. And then the environment also influences that. This is like if you have a pet outdoors where there's temperature extremes, cold, hot, high humidity or whatever, wind, etc. Neutered pets have lower metabolic rates and increased food intake as well. So they eat more and they lose less weight. So it can be difficult to control the weight or the fat content, body fat percentage of a neutered pet. Puppies and kittens require more energy than an adult. Reproducing adults require a lot more energy. And then senior dogs actually need less energy, but senior cats need more. So most patients in general need about 0.8 to 3 times their energy needs at any point in time for any number of reasons. Okay, that's it for nutrition. On to anatomy. So the thoracic limb. There's a bunch of bumps, holes, depressions in bones. And they're more prominent in dog bones than in cat bones. But cat bones are generally straighter. The shoulder blade is called the scapula. The brachium is called the humerus. The antebrachium contains two bones, the radius and the ulna. And then the manus contains the carpals, which is your wrist, the metacarpals, and then the phalanges, which are your fingers, your digits. The shoulder has no articulation with the trunk. A cat has a well-developed acromion. And then it has a joint called the glenohumeral joint, which is the shoulder joint. And then it has a clavicle, which is vestigial in cats, but you can sometimes see a remnant on radiographs. Then, moving on to the arm, we've got the humerus, we've got the supratrochlear foramen in the dog, which is like a hole in the humerus. Nothing goes through it though. Now in a cat, there's no supratrochlear foramen, but there is a supracondylar foramen, which the brachial artery and the medial nerve pass through that. Okay, and then there's the cubital or the elbow joint. This is found at the connection of the humerus and the radia and ulna. So like, that's the elbow, right? All right, and then we have OCD, which is osteochondritis dissecans. This is an abnormal development of cartilage on the end of a bone in the joint. It's an inflammatory condition that happens when diseased cartilage separates from the underlying bone. Okay, then there's a humeral condyle fracture. Usually at the elbow joint, well, it's always at the elbow joint because it's the humeral condyle. The radius supports 80% of the body weight and the ulna supports 20% of the body weight. The radius is in contact with the lateral point of the lateral part of the humeral condyle, and forces that are transmitted through the limb can break off the lateral aspect of the humeral condyle. Lateral meaning, like, okay, so this is medial, the middle. Lateral is out from the middle. More fractures occur in immature dogs too, young dogs, because their bone is weaker. Okay, then we have antebrachium, otherwise known as the forearm. Those contain the radius and the ulna, the two bones. They allow pronation and supination. And okay, the ulna starts medially and ends up laterally. So I think it starts like right here. I guess it ends up that. That is strange. Especially if you're rotating. But dogs can't rotate that much. Dogs and cats. They do rotate a little bit though. Pronate. So pronation is whenever you turn in. Supination is whenever you turn out. Think of supination as if you're holding a bowl of soup. So like if you were here, supination. Okay, and then, yeah. Fracture. Whenever you're taking a radiograph, you want to take two, I can't remember the word. It's probably down here somewhere. But you take like one radiograph from one angle, and then you take it from a complete other angle. Or else you'll never know if something's really wrong because it's a 2D picture of a 3D object. Okay. The carpus, the metacarpals, the digits. Cats have a distal phalanx held by dorsal elastic ligaments. That's the their distal phalanx is literally their bone that contains their claw. And so whenever veterinarians do a declaw, they're literally cutting out that bone. Now, it can be a very damaging procedure, but there's other ways to make it a lot less damaging, like laser. Well, I'm about to talk about it right now. There's the guillotine method, which is like this handheld tool that just basically rips off their. It's very damaging. That's not a good method. Then there's the then there's a scalpel removal. You use a scalpel to cut out that bone. It's a lot better. But you still have to use tourniquets and pressure bandages. There's a lower incidence of chronic pain and lameness as a result. And there's little to no regrowth. And then there's the laser technique, which is even better, but it's just more expensive. You know, you have to get trained, you have to get the piece of equipment. It's not easy. Okay, muscles act on joints. They don't act on bones. You have to cross a joint to act on it. And it's also important to know the flexor angles. Flexion reduces the flexor angle. Extension increases the flexor angle. So here's the angle. Reducing that angle is flexion, and extension is increasing that angle. Extrinsic muscles have one attachment to the axial skeleton and one attachment to the appendicular skeleton. Okay, so these are muscles like the omotransversarius, the trapezius, the rhomboideus, and the serratus ventralis. Superficial pectoral muscles, deep pectoral muscles, brachiocephalicus, latissimus dorsi. Well, I don't need to say that. The intrinsic muscles we need to know the functions of, and the attachments. It's a lot. There are There are the stabilizers of the shoulder, which are the supraspinatus, the infraspinatus, the subscapularis. Then there's the flexors of the shoulder, the deltoideus, the teres major, teres minor. Then the extensors of the elbow, the triceps brachii, anconeus, tensor fasciae antebrachii, the flexors of the elbow, biceps brachii, brachialis, coracobrachialis. The coracobrachialis actually, I think, just stabilizes the shoulder. There's a lot of stuff here. I'll talk about it later. And it must cross something to have it in the name. That's what makes it easier to remember. Like the extensor carpi radialis. Crosses the radius, extends the carpus, or the carpal joints. Okay. And that is it for August 21st. I've got a lot of catching up to do. Thanks for watching.